Hi, my name is Christopher Darragh. I enjoy playing video games, the odd bit of mixed martial arts training, and I also love listening to musicals. I am also a general practitioner in the Shoalhaven region. So I work at Cottage Medical Practice, which is part of Heritage Medical, and it's a new practice that was set up in Bury, and it's just opened in February, so I've been here since February.
Why did you choose to work in Shoalhaven?
So I grew up in Sydney and did all my medical training up in Queensland. In my final year of med school, I attended a rural clinical school up the coast, and after doing a few rural, really remote terms in residency, I figured that I'd come down to Shoalhaven where I could get the best of both worlds. So smaller community, but decent internet connections. So my main passion in medicine is teaching, and living in the Shoalhaven allows me to engage with the local University of Wollongong and teach at their local rural campus. Living in the Shoalhaven kind of opens a door to an area that a lot of people know is great to visit, but also fantastic to live in. So one of the advantages of practicing in the Shoalhaven is that I've fallen in with a really good group of doctors here. So all the local GPs will at least know each other by reputation, and I've met quite a few of them at local events. What that's led to is we've really rallied together and pooled resources really throughout the pandemic, including sharing of PPE. If one practice gets short, then we kind of put out a call, and generally someone else can help us out.
What are the challenges that your community faces?
So the issues in the Shoalhaven that we face are quite similar to other regions. So rural communities have a lot of problems that are just amplified by how isolated they are. One of the major things that I've noticed in the Shoalhaven is people living down here are a little bit more isolated from their families who live a bit more centrally. So one thing that we've made a priority here in Bury is working with the Bury Men's Shed. So we've been setting up a health fair initiative with the guys here. And it's modelled closely on a version of the health fair that we did down in Birmingham when I was down there.
How does your community affect how you work?
So being a male GP, I tend to attract a demographic of middle-aged men, sometimes approaching retirement or just after retirement. And it's very interesting how it's influenced my consult style. So if I were to present myself with the utmost professionalism, I would have a little bit of trouble engaging with these patients. So a lot of them are older farmers, and it's kind of led to me having a slightly more relaxed style when I do a consult. So rather than treating it as a medical exercise, generally the 15 or 30 or 45 minutes that it takes tends to turn into more of a conversation. So I remember one patient who I met shortly after she was diagnosed with terminal cancer. And her priority wasn't my medical knowledge or what I could do for her, but just that we could get along and that we were on the same page in terms of working towards common goals. So over the next 6 months that I knew her, part of the consults became me walking her out to her car so that I could have a quick 2-second chat to her very stoic husband. After she passed, I found out that they were actually friends with a few other patients that I had, and it meant that I could get little mini updates from them as time went on. And then also I'd run into these people at the pub or down at the beach or things like that, and it just meant that you could stay linked in and engage with everyone. In general, I try to make sure that I'm engaging with each individual patient, and that's definitely something that has developed more and more the more time I've spent rural. If you're in the middle of the city, you can call up a specialist and have the patient drive 2 minutes down the road and get them checked out. If you're practicing somewhere that doesn't have those services, so some places I've worked at, we didn't have the ability to get blood tests on the same day. Patients would have to drive for an hour to get an x-ray. It places you in an interesting situation where you start thinking about exactly how you practice medicine. What I can offer the patient right here in the room is that I can talk to them, communicate, and let them talk through their problems. Then the medicine comes next. So if a patient comes in, you weigh all that up, and then you add in this weird modifier of how far are you going to put this patient out. So if someone came in with a cough or a cold or something, In the middle of the city, you might be tempted to send them for an x-ray. But if it's going to be an hour drive, one way, then you might not do that. You might start treating, or you might advise them to hold off for a day or two. Medical knowledge is really easy to come by now. So everywhere that you go will have the internet, you'll have access to the therapeutic guidelines, you'll have access to all this information there. But the difference is how you apply it. So if you are out there, you can always look at the guidelines, but you've also got to figure out how to modify them too. So you won't just be doing cookie cutter medicine. You'd be sitting there working with the patient to figure out exactly how you're going to achieve your goals. So would I recommend going rural? So yeah, I think I would recommend it to anyone who wants to try it out. It is going to make you a better doctor, pretty much. So a lot of colleges and training programs will mandate that you go rural for at least a small stint. And I think that's a really good taste. So my main message would be just not to rule it out. So I never pictured myself working anywhere rural, let alone liking it. So you'd be surprised at how really fun it can be. So if you're thinking about it, definitely go for it. If it's something you haven't considered, then just keep an open mind. And yeah, try it out when you get the opportunity.